To kick off the webinar, we would like to thank our sponsors, AmPlus, Commerce Healthcare, Progressive Management Systems, Parallon, Firm, TCF Capital Solutions, Harris & Harris, Extend Healthcare, Access One, HRG, AccuReg, Novus, Mail My Statements, Berlotte, Premier, Centauri, TrueBridge, Avidyne Health, Patient Matters, Argos Health, RMC, Enable Comp, State, Sherlock, and Aid Bailey, Softtech, OVAG International, and VitalWare. Your participation is required. There will be a live Q&A during the webinar, so put your questions in the Q&A pod. We'll also be utilizing the chat pod, so share information and tips during our session. And now it's my pleasure to introduce Ramona Hernandez, Regional Executive 2 for Region 11.
Good afternoon, everybody. I'm Ramona Hernandez. I'm with the Northern California chapter, and as Erica mentioned, I'm also the RE, so Regional Executive Elect. And so I'm happy to be here and to be here to introduce to you today our speakers. So I'm going to start with our main speaker, Ben Colton from ECG Management Consultants. So Ben is a leader at ECG. He leads the revenue cycle practice, and he assists health systems across the country in evaluating and optimizing and improving the revenue cycle to support and enhance financial performance, along with operational alignment. They focus with engagements to expand beyond helping clients realize only a one-time opportunity, but emphasizing instead the establishment of the revenue cycle environment that supports and continuous improvement. Recently, he helped the $6 billion academic medical center integrate the hospital and professional revenue cycle operations into a single structure. He's also assisted 500 million faculty group practices in establishing the vision and plan for centralized revenue cycle operations. So without further ado, please welcome Ben Colton.
Thanks, Ramona. I want to make sure things are, there you go. Just want to make sure, technical check, did you see the slide move? Ramona can give me a nod if that worked.
Yes,
okay,
I did move.
Great, thank you. So thanks, Ramona. So we want to appreciate you guys joining today's webinar. It's addressing patient collections during a pandemic and beyond. We all know the financial pressures that healthcare organizations are facing are very real, and they've only been exacerbated by COVID. Reimbursement has steadily been on the decline, costs have been rising, and unfortunately since March, most of us have been dealing with significantly impacted volumes due to the pandemic. And all of these factors are eating into the margin. This scenario has absolutely created a burning platform for having a laser focus on an efficient revenue cycle. So we know that revenue cycle has always been important to the health of our financial stability in healthcare. However, it's even more critical that we're collecting every dollar and even every penny owed for the services that we're providing. That said, the challenge presents itself that self-pay collections account for a growing portion of overall health system net revenue. And this is, this is a statement that at least within our firm, within our practice, we have been talking about for a long time, and was absolutely a high priority for us to communicate to our clients, is the criticality of focusing on patient collections. But while self-pay has always been a problem area for many organizations, with COVID forcing millions of people out of work, self-pay balances are at even greater risk than they were before, as consumers are tightening their purse strings and reprioritizing their expenses. So this presents an even bigger dilemma for our providers in local communities. How do you ethically pursue patient balances while demonstrating empathy and understanding the situation. So, as Ramona said, my name is Ben Colton. I'm a principal with ECG. Just a little bit about our firm, pretty traditional healthcare management consultancy. We only operate in the healthcare space. I think what carves us apart is we don't have any, we're not trying to push any outsourced solution or other proprietary technology. Our goal is really to help our clients think through how to develop a revenue cycle strategy that is appropriate for your unique environment. And so I've brought a couple of my colleagues to the table today. Sungmin Lim and Chris Ford are both a part of our performance transformation practice with me. After today's discussion, we'll have hopefully left you with a better sense of how to deal with this significant challenge. So in terms of our agenda, first, I'm going to provide a bit more context in terms of the growing importance of patient collections and how COVID has created a perfect storm for us. We're then going to walk through several strategies to consider across the revenue cycle continuum, from the time of pre-service all the way through patient follow-up and, unfortunately, into bad debt. The goal is that we want to leave you with some implementable solutions to consider that are compassionate, but still protect your bottom line. So now let's start to set the stage here. As I previously mentioned, self-pay collections account for a growing percentage of overall health system net revenue. Both employer and individual sponsored health insurance plans are mitigating the rise of healthcare costs by passing them on to consumers through copays, coinsurance, and deductibles, making patients more financially responsible for their healthcare utilization than ever before. To put this into perspective, high deductible plans are defined as individual coverage with a deductible of about $1,300, or a family coverage of at least $2,700. Since 2010, the percentage of privately insured patients under the age of 65 with a high deductible plan has nearly doubled from 25% to 46%. What I'm more concerned about, though, is that nearly 30% of covered workers have a general annual deductible of about $2,000 for single coverage. So that's very considerable. In addition to the increase in high deductible plans, we're also unfortunately seeing a recent growth in uninsured Americans. The net result of these factors is that patients are becoming an increasingly significant part of our payer mix. A recent article in Forbes suggested that patient responsibility now makes up about 35% of provider revenue. This is the third largest source of income behind Medicare and Medicaid. Of course, this is going to vary based on your individual payer mix, but hopefully it demonstrates sort of the themes that we're seeing across the country. And the impact to the patient is very real. In 2018 alone, patients experienced an average increase of 12% in their out-of-pocket responsibilities. Unfortunately, and unsurprisingly, studies have shown that patients are unable to keep up with the increasing burden of their healthcare costs. More than 60% of American adults are carrying around some degree of medical debt, and nearly half are struggling to pay larger bills. According to a study done by the Federal Reserve, 4 in 10 people would need to borrow, sell something, or not be able to pay if faced with a $400 unexpected expense. Now, that's not just healthcare. That's just an unexpected expense in general. But what's more troubling is that in a recent survey by TSYS, they found that 37% of Americans would be unable to pay for an unexpected medical bill of $100 or more without going into debt. This is very alarming when you're considering the fact that $2,000 was the average high deductible plan. So, way less than 10% of their high deductible. The impact of this is that patients are being thoughtful about where they receive their care and how much it's going to cost them. I mean, this is in line with the general thoughts of consumerism that we're seeing across the country. They're also asking for more flexible options for payment. As such, it's critical that healthcare providers develop a patient collection strategy that addresses these issues. Because if we don't think about this, if we don't consider this, ignoring the growing importance of patient collections is gonna just have a drastic impact to a hospital, health system, or medical group's bottom line. The AHA recently released a study which showed that 2018's uncompensated care grew to $41 billion from a 10-year low in 2015. And this isn't just coming from high deductible plans and the uninsured. Medicare bad debt represents about 10% of that, or $3.5 billion, demonstrating that population's inability to cover their coinsurance and their deductibles for covered services. And the impact to hospitals is very real. Nearly a third of hospitals carry over $10 million in bad debt in 2018. Now, I'm gonna pause for a moment. You've heard me say 2018, 2017, 2015 a few different times. That's because that's when the studies were performed. And of course, the majority of facts and stats that I've shared during this discussion were from well before the craziness that we've been experiencing recently. The reason why is because I wanted to make sure that we recognize that defining a clear strategy for patient collections should have been a priority for most organizations headed into 2020, and I wanted to underline the importance very clearly. But the pandemic has certainly thrown us a curveball. Between February and May of 2020, about 22 million workers in the US lost their job. And as a result, about 5.5 million subsequently became uninsured. This is excluding workers' family members who have also lost health insurance. These factors are most certainly going to impact the volume of uncompensated care in this country, but also just fundamentally how we're going to approach our self-pay strategies. As the COVID-19 case count increases, some health systems have just suspended patient billing for related testing and treatment in order to encourage patients to seek care and just out of general goodwill for the community. But since self-pay balances for non-COVID related services still make up a significant portion of our AR, they can't be ignored indefinitely. That would just be irresponsible. Doing so is going to result in negative consequences across the revenue cycle, such as an increase in AR days, bad debt write-offs, and resource expense, along with just a general decline in cash flow. But that said, while we can't ignore it, we do need to develop strategies that are thoughtful and compassionate during these unprecedented times. We also need to consider that our physical environment has fundamentally changed. While face-to-face interactions historically presented an opportune time to address financial counseling and patient responsibility, even just as simple as asking for past due balances and copays at the time of service and at the front desk or at patient access. The considerable shift to telehealth, so taking them out of the clinic, out of the traditional ambulatory space, so we don't have that direct face-to-face contact, as well as the fact that many of our revenue cycle staff are working from home, is going to require us to develop tactics that are more appropriate for our new normal. So before I pass the baton over to Sung Min, I wanted to underscore the need to focus on patient balances has not gone away in the wake of COVID. In fact, it has presented an even greater imperative for designing an effective self-pay model. The inverse relationship between growing patient responsibility and their ability to pay is increasing the risk for bad debt and the impact to the bottom line. Building a culture that acts on patient needs and demonstrates empathy while maintaining focus on the organization's financial requirements should be the foundational tenet. Providers that fail to proactively address this area of the revenue cycle now place their future financial health at risk. But by prioritizing a patient-centric approach, organizations will improve their financial outcomes. To that end, I'd like to introduce my colleague Sung Min Lim to walk through our first set of strategies. Sung Min?
Thank you, Ben. Hello, everyone. My name is Sung Min, also from ECG Management Consultants. So like what Ben mentioned, there are only so many things that providers can do about lowering the patient's actual out-of-pocket amount unless the patient qualifies for charity or financial assistance. But there are a lot of opportunities throughout the patient journey to financially and mentally prepare patients for their responsibility, which are often being missed by many providers. So from our experience, it absolutely makes a huge difference when you touch base with patients before service to have an upfront financial conversation. One example that sounds easier said than done is price estimation. A lot of providers struggle with this because they don't have technology or have a very poor configurations to integrate chargemasters, contracts, and CPT information. But having this process and technology figured out is such a big win for both providers and patients. And those patients who become aware of their responsibility are the ones who are more likely to pay full amount down the road, or at least be more engaged in a payment plan discussion. Now, how you are implementing and managing the price estimation process is a different story, since you want to make sure that you have a nimble enough process and technology to adapt and respond to the changing environment, policies, and contracts. So for example, during this pandemic, you want to make sure that you update the patient estimate algorithm behind the scenes so that the appropriate discounts are applied for COVID-19 related services. So that way, there's no mismatch, for instance, in what you are communicating to the patients between the front end and the back end. And another big opportunity for providers is proactive coverage screening or financial counseling, coupled with pre-service engagement outreach. So in an acute hospital setting, for example, it's pretty common that you prioritize self-paying patients and observation patients, those high-dollar patients, to screen for their eligibility for either subsidized marketplace coverages, straight Medicaid, or disability. But we've seen many cases where you don't really have simply a bandwidth to screen regular outpatients or emergency patients. But the self-pay balances from these outpatients, they do add up quickly, and we've seen thousands of outpatient balances being written off every year at the end of the day under the name of this small balances write-offs or aged AR cleanup projects, when you can actually make slight changes to your front-end process and technology to reach out to a wider population early on, almost without any additional manpower, and increase this Medicaid conversion rate and ultimately the patient collections rates. Especially during this tough time where we expect a surge of self-pay patients, it is absolutely important to cast a wider net early on, so to speak, but in a creative way so that you don't necessarily have to hire tens of additional financial counselors. It can be a text message before service with a link to a simple survey that takes you through a coverage eligibility question, for example. It can be signages and flyers throughout the facilities and the front desk that advertises a self-service financial counseling program. It could be a cross-training program where schedulers and pre-registrars are trained to ask just a few quick questions while they still have the patients on the phone and flag those patients with higher chances of getting their applications approved for a follow-up later on. Well, at the end of the day, every organization has their unique situation where one strategy makes just more sense than the others. But my point is, providers should really focus on implementing a lean and tech-savvy solution that really allows you to reach out to and engage much more patients to communicate this price estimation, coverage screening, and financing options without really having to dramatically increase your staffing. And one last thing I would mention on this slide is a mobile check-in process. We know a lot of providers used to use a kiosk or shared tablets for patients to check in. But obviously with COVID-19, these kiosks and shared tablets are not just an option anymore, but instead, what may work even better actually is to have your patients bring your own devices to check in for a sanitary purpose, but also it's a great way to put them in the driver's seat for their financial experience. And also it's a tremendous opportunity for them to break barriers to the online platform. Because once your patients are introduced to this mobile app for check-in, they are highly likely to go back to that app to check on their benefit information, billing statuses, get their questions answered, and make payments. And there's one survey done at Dallas Nephrology Associates, for example, where 80% of their patients wanted to check in for a visit from their own mobile device, and 65% would download a mobile app to pay for their healthcare bills. So this is quite telling. Next slide, please. So I'll be relatively quick on the slide. Actually, if you would go back to the slide before. And I'll be pretty quick on this slide. We just wanted to stress how much of the collections problem is tied back to the patient engagement issue on the front end. So close to 3/4 of average consumers are confused by their bills and EOBs. More than half are really caught off guard by an unexpected bill or the amount due. And eventually 37% of them are really sent to the collections. So this is a very clear sign that an average healthcare organization is missing opportunities to prepare, engage, and educate patients up front. And all the things that we discussed in the previous slide, the front-end price estimation, wide-ranging coverage screening, and pre-service outreach, and mobile check-in, they should and will have a direct impact on all of these metrics across the board, and ultimately your organization's financial bottom line. Next slide, please. So the next step of the patient journey is the provider interactions. And you may think that there is a limited opportunity for patient collections during the actual provider services. And it is true to some degree that the physicians don't really have time or all the knowledge to discuss the financial and payment options with patients. But it is absolutely important how the handoffs are handled from physicians to the administrators real time during the visit. And many times right after the physician services, that's a great time to kickstart the in-depth financial conversations with patients, because the patients are right there with you, they are engaged, and they're curious what the next steps are, especially financially after the care. But what's challenging during the COVID-19 is that the patients are often not in person anymore. So with telehealth, the physicians and nurses can just walk the patients down the hall to the checkout desk to just hand them off. And oftentimes, what we are seeing with telehealth is this disconnect between the providers and the administrators that results into this lost opportunity to educate and engage patients at the time of checkout that we used to have before the time of COVID. So you want to make sure that you configure your telehealth technology so that the providers can seamlessly hand off the patients to the administrators to create this right environment for patients to dive deeper into their financial situation. Then the administrators can really lay out various payment options, especially during COVID. It's important to be flexible policy-wise, and we know many consumer-facing organizations, not just in healthcare, but also outside of the healthcare industry, we are all providing alternate third-party options, interest-free financing, and variable terms, and deferred payment options, for example. So also this is an excellent time to apply a sliding fee scale and other available discounts during the time of checkout, if applicable, of course. So navigating this patient through all these options is a lot less intimidating for patients when it happens right after the service at time of checkout, face-to-face, and a whole lot easier for providers to secure payments down the road instead of waiting for many months and trying to reach out to the patients who just won't simply return your calls. But we're not out of luck with improving our chance to collect patient balances beyond the front end of the revenue cycle. There are obviously plenty of other tactics, so to speak, that you can deploy on the back end side. So with that, I will hand it to my colleague, Chris Ford.
Thanks, Sungmin, and thank you all for the time. So we've just covered the importance of really bolstering those front-end touch points to encourage proactive participation in the planning of the patient's financial journey. But once we've exhausted kind of those face-to-face touch points post-service delivery, there are still some strategies that we can deploy on the back end of the revenue cycle to continue to drive the revenue, continue to minimize that risk that Ben spoke about earlier, and really to forge those lasting relationships within the communities that we serve, okay? And so we're gonna discuss this through the lens of adopting stratified collection strategies. And what we mean by that is really stepping back and taking that strategic view of your self-pay collection processes and really challenging the status quo. So asking, is the work organized and prioritized appropriately? are we getting the biggest bang for our buck in terms of our resource inputs and the outputs, or the revenue that we're collecting from those inputs? Is our consumer outreach appropriate given the time that we're in? And do we have consistent voice and a consistent message across the organization that takes into account what folks are going through right now? So with that in mind, what are some things that we can consider? So we'll start with financial clearance processes, which Sungmin did a really good job talking about. And if we followed along and we've implemented all of those strategies up to this point, we have a robust screening process on the front end where we're doing our insurance and eligibility verification, so that both ourselves as organizations and the consumers, we have a mutual understanding of what that financial responsibility is. We can, however, continue to strengthen that financial clearance process even on the back end. So things like Sungmin had mentioned, eligibility screening for things like Medicaid, right? We can add another layer on the back end before we bill to do an additional screen. So we've got things in flux right now with folks out of work, and let's face it, sometimes we just don't get to the financial clearance in the normal course of business. Either we don't have time, it falls through the cracks, whatever the reason. Adding an additional safety net or layer of Medicaid screening will allow us to secure payment more quickly, as opposed to expending the resources to kind of chase down that money. We send the bill to self-pay. The patient has to contact us. We end up rebilling it out to Medicaid, and that payment tail is extended way out, as opposed to if we would have just implemented that screening right before sending that bill out. Additionally, and critically at this moment, is to make sure that those payer bulletins that are flying into our mailboxes right now at incredible rates, make sure that those are received, that they're cataloged, and that they're distributed to all of the relevant players across the organization. This has been one of the pain points that I've heard as I've talked to some of my clients, is just being able to keep up with all of those communications right now that are coming from every which way, and then being able to actually integrate those into the workflow so that they're meaningful and contributing to the operations. Propensity to pay segmentation is another tip or tool we can look at, and we can use this technology to evaluate factors like credit scores and payment histories. And again, that helps us categorize and prioritize our outreach. I think propensity to pay has become pretty prevalent over the years in billing offices, but even if we have it in place today, that doesn't mean that we can't step back and reassess our stratification policies. So perhaps we're looking at pulling back on medium to low propensity to pay scores for a given time, so we're not targeting them as aggressively. So we can use propensity to pay scoring to kind of reconstruct our outreach and our strategy. Also, on propensity to pay front, this might be a good time to actually reevaluate some of your relationships with your vendors. So ask yourself, are we potentially sending accounts to early out and paying a premium for our vendors to collect on accounts that, maybe if we held for 10 to 15 more days, those high payers would pay us anyway. So is there a financial opportunity there to maybe, again, readdress your strategy of what you're sending out versus holding on to and keeping in-house? Moving on to outreach frequency and messaging. Really, this is about being sensitive to the frequency of your patient outreach, right? So again, maybe we're looking to scale back mid-cycle calls or texts or emails. So more of a hands-off, maybe one time per month statement, so that we're not, hammering people and reminding them every 10 days about the bill that they can't pay, right? And similarly, we can, continue this message of compassion and empathy by being proactive in our communication. So we can use things like dunning messages, or we could include a statement mailer that basically says, we understand the times and we're here to work for you and on your behalf. So please reach out to us if you're having trouble paying. Being proactive in that communication will elicit more responses than, continuing to just send a bill to someone that lands on their door and they're just feeling nothing but pressure to pay that bill or go to collections, right? And that segues into bad debt placement. consider the implications of enforcing your collection policies right now. Again, just with everything going on, if folks are struggling with whether it be rent or food or other necessities, is now the right time to send someone to bad debt over their medical bill, or do we have some ability to loosen those restrictions or those policies and work with patients a little bit longer than maybe we have in the past? So again, this is really more about evaluating yourself and optimizing your internal processes and your strategies as opposed to really influencing consumer behavior. But nonetheless, these certainly will impact your patient collections. So we'll move on to the next slide here and kind of step 4 in our 4-step process, talk about customer service. So really, we need to focus on consumerism to optimize the patient experience. So said another way, what can we do to make it ridiculously easy for consumers to pay us? So it's no secret. I don't think anyone would be surprised to see that, positive consumer experience yields positive margins. So U.S. hospitals that deliver superior customer service achieve net margins up to 50% higher than those with average customer experience. And so it begs the question, how do we deliver that superior customer experience, right? So first and foremost, let's talk about customer service operations, right? We need to be accessible. So if consumers have questions, we've got to be able to answer them. So make sure that we've got a fully staffed call center or customer service team, that we understand the demands and that we're staffed to receive those calls when they're coming in. If we're open from 8 to 4 and most people call at 6:30 after work, we're probably not servicing our patients the best way possible and giving them the access they deserve and need. Secondly, our agents need to be competent, right? So we need to be able to competently assist the patient financial journey, or we've got to have a readily available resource like a dedicated financial advocate, a transfer away or a cubicle away that we can toss that over the fence and they can continue that discussion with the consumer. And, I think that just further enforces the need for that kind of central knowledge repository that I alluded to earlier when talking about the payer communications, right? We need to make sure that everybody across the organization is running from the same playbook. I need to be able to pick up that phone as a customer service agent and be confident that the information guiding my decision-making in that phone call is the same thing that everybody across the organization has seen and is going to see, so that we're not giving mixed messages and confusing our consumers. And finally, one that's often overlooked is external customer service. If your customer service team is external, it's important to make sure your vendor functions and is perceived as a extension of your business office, as opposed to a third party who is calling you just to get money, right? And so I think again that's often overlooked, and the sensitivity some folks have, and perception is reality. It may not be collections, but to the consumer, you've turfed that bill to somebody else to chase you, and so making sure that there's a seamless connection there, and that they're putting themselves out as an extension of your organization's business office. Next, payment technologies. So partner with vendors to implement mobile and web-based applications. 87% of consumers in a recent study reported that they want to make all their healthcare payments in one place. And again, I don't think that is surprising to anyone. I think consumers nowadays expect to be able to view and manage bills in a user-friendly app environment. I mean, think of every bill you pay today, right? They don't want to have to pick up the phone to make a payment. They want to be able to log in to view their balance, to set up their own saved payment preferences, to set up recurring payments, to enter into plans, all without talking to anyone. So self-service is really an important feature here, and continues to be so, given that it's just kind of normal everyday life for us in our app-enabled world. So additionally, not just having the technology there, but making sure that we're keeping pace with the times. So again, sure we all know with our devices and even on websites, we now have the ability to do things like pay with Venmo. or pay with Apple Pay or Google Pay, or link it to our PayPal account and use funds that are in our PayPal account to pay bills. And so I think it's important that we continue to seek out and try to integrate where possible those kind of one-touch or no-touch solutions to streamline the payment. I mean, kind of using myself as the case study, I would be lost without my apps and my auto payments that ping me and allow me to just, scan my face on my phone and my bills are paid, right? And so consumers are used to that and they demand that kind of convenience. So the next slide, just want to make sure that we drive home the importance of the convenience with a few studies and some interesting numbers here. So again, we know that the consumers are demanding this convenience, but the study here that we're looking at from the Consumer Healthcare Payment Survey, it shows that the healthcare market has been slow to adapt. So just kind of ticking through quickly these stats, 87% of consumers, they want to know their responsibility, but 53% of providers can't provide it. 71% of them want to get an e-statement, but 83% of consumers don't get their medical bill electronically. 73% of consumers want to set up an automatic payment and not worry about remembering that every month. However, 61% of providers don't provide for automatic payments. And so this is very, very telling to me because, again, the studies are out here, they have been, but for some reason, the market has been slow to adjust. And so I think the point here is that convenience absolutely matters. 80% of the same study, 80% of patients reported that convenience factors would be enough to make them switch providers. Similarly, 61% of them said that they would consider switching providers just for a better payments experience, okay? And so if we make payment convenient, we only increase our chances of getting that payment and getting it quicker, right? And so I just wanted to drive home the fact that convenience is absolutely a key factor in how patients behave and how they pay. Okay, and with that, I think we're on to our takeaways here. All right, so to wrap this all up, kind of 4 key points. So healthcare organizations, we're experiencing that reduced cash flow, that staffing, as Ben spoke to at the top, right? We need to make sure that we have resources and solutions in place to continue to drive our very important accounts receivable, that is patient collections. And again, these are a significant portion, so we cannot ignore these. It's a fine, it's finding that right balance between collecting from the patients who can pay, but providing that flexibility, that understanding, and that empathy for those who cannot. And then finally, just again, stepping back and challenging the status quo. So, making sure you're understanding what your current protocols are, how they can be adjusted and incorporated, and incorporated into your workflows. I think it's important to note from all these tips we went through, none of these are one size fits all. As Sungmin mentioned, it's about understanding what each brings to the table and then determining whether that has value within your organization and or whether you have the ability to implement it. And, some of these things certainly do take some resources, and so maybe that's not in the cards right now, but there are absolutely tips that we covered in here, and you can make positive changes with really little to no additional resource input. All right. And so with that, Erica and or Ramona, I think we are through our presentation and can probably open it up for some Q&A.
Yeah. Well, it looks like we don't have a tremendous amount of questions coming through. One question was that are the slides going to be made available? And Erica is going to make sure that the recordings and handouts are going to be sent out to all the attendees as well as posted on the Region 11 websites.
Yes,
So,
that's correct.
Terrific. So with that said, we wanted to leave some time available, but I also don't think that we need to keep everybody on the line if there's no other real questions. We will make sure that as the email goes out, you have our contact information. Certainly, this is a unique time. Our clients are developing these strategies as we go. To some degree, we're building the cars, we're driving it, and adapting some strategies that were in place prior to the pandemic. But I think that, again, what I want to underscore, and I said it at the outset of the webinar, and what Chris was building on here at the end, is that we cannot use COVID as an excuse to dial down our patient collections process. Those dollars are increasingly important given the financial strain the pandemic has placed on ourselves. But we need to make sure that we are adapting and adopting strategies that are appropriate for this new environment. So with that said, we appreciate your time today and the ability to meet with you all remotely. Often we do these types of these discussions live in some sort of conference, but the new normal of the remote environment and work from home has enabled us to reach out more through these webinars and remote discussions. So Ramona, thanks for inviting us, and we appreciate the time.
Yes. Thank you, gentlemen. Thank you for your time. And as Ben mentioned, these will be available to you. We're going to get this out to your chapters. Also look for an email that comes from us regarding a survey. We'd like to know what your thoughts are and what you would like to hear from us in the future. So again, thank you to the entire Region 11 and for your time and participation. Have a good afternoon.
Thank you, Ramona.
Thank you.